Traditionally, people have always thought that actually the patient needs to be in hospital, you looking at them on a daily basis or part of your team doing that. But actually I think healthcare has changed, and I think the majority of patients now actually prefer to go home. And I think with a setup that can see the patients in their own home, because we're here less frequently than we used to be in traditional days, then actually I think going home for the patient and getting cared for at home is probably better.
The idea of helping patients to leave the hospital quicker, shortening their length of stay, improving that patient pathway was something that was a positive move, seen as a positive move on both sides.
People with long-term conditions especially are very, very used to their condition and the way they need to be treated. And the nurses have been fantastic with that and very open to talk about how I need my treatment to be given. And I'm aware that the nurses meet with the CF team regularly, I think every week, to discuss the patients, which gives that real sense of security, I guess.
They get enhanced support, so they're not just there with their relative or their carer, but they've got an enhanced support from the healthcare at home nursing team, physio team, healthcare support workers and the healthcare at home care bureau.
It's manned by qualified nurses, which the patients have access to 24 hours a day. So they are given the telephone number, they can phone, even if it's at 2 o'clock in the morning and they're just feeling a little bit unsure.
They provide a rapid response team 24 hours a day, 7 days a week, 365 days a year, which is a level of infrastructure that gives added value to our patients and to our clinicians when working in this type of way.
When it first started, it was seen perhaps as more of a cost-saving exercise rather than true benefit for the patients, and quite a few of myself and colleagues were fairly sceptical. This changes the way we've treated patients in the past. Now I see it actually as a positive advantage for the patients rather than saving any money or trying to get them out of hospital quicker, and we've found that keeping patients in hospital unnecessarily is both expensive and also does cause further problems for patients.
There's been about 1,200 patients referred onto the healthcare at home service. For us has meant that 7,600 bed nights that would otherwise have been consumed in the hospital have been in patients' own home. There's been around 10,000 home visits from the healthcare at home team, and that's amounted to about 35 to 45 patients at any one time that are on the healthcare at home service who would otherwise have been in hospital beds here within the acute hospital.
When we started here, we were picking just certain conditions. So for instance, we were doing some knee replacements, we were picking fit and healthy patients that we thought might cope very well with it. But interestingly, over a very short period of time, we said, well, actually, most of the patients undergoing knee surgery here could probably look at this pathway. So actually I think it could be generalised to other things. Certainly we're doing it for elective surgery, we could do it for some of the trauma conditions, perhaps some of the less invasive or less serious conditions. But actually I can see this becoming a model of healthcare for the future.
Obviously it's much better for the patient because patients much prefer to be in their own environment. Evidence suggests that patients recover much better in their home environment, and who wouldn't want to be at home?
The level of satisfaction that we've had back from patients around this service has been overwhelmingly positive. So over 99% of our patients have said that the service was excellent.
At the moment we will cover pretty much any condition. Any ward can phone us with a patient they think is suitable. We will go and assess the patient. If we can go in and see that patient, we will, whether it's to give them IVs, to do blood tests, teach them how to do injections, just to give them a bit of reassurance for a couple of days if they've had a major operation. Any acute wounds that the district nurses are not happy to look after, we will do that under the consultant's instructions.
We rely very heavily on the nurses here and the sisters and the nurses that we work with for many years. So one of the first things was that we wanted to know who was going to look after the patients.
We made sure that we built up a relationship between the staff from Healthcare at Home with our ward staff and with our consultant staff. So actually the Healthcare at Home team became embedded within the hospital overall. The partnership with Healthcare at Home does allow us to use the expertise, knowledge and innovation to bring those skills into the hospital sector so as we can benefit patients. A further benefit is the overall cost of running this service is less than it would be for running a traditional hospital ward, and that money can be reinvested into other clinical services and therefore benefit a wider range of patients.
You know, in a year, in 2 years' time, this is going to be the normal way of caring for patients post-operatively, post-acute illness. The home is a far, far better setting. It's just the start, and it's going to grow massively.